I need doctors who are open-minded, who are, willing to try new things. Many of us did not receive a lot of pediatric training in dental school. And so I need doctors who are willing to step out of their comfort zone, open to mentorship, training, and coaching.
Welcome back to the Dental Economist Show with me, Mike Huffaker. Today, we're thrilled to have Dr. Emily Vanney, Chief Operating and Clinical Officer at United Dental Partners. Emily has over a decade of clinical experience with a proven track record of fostering collaboration, improving efficiency, and driving growth across multiple dental offices. She has a lead role in fostering a culture that provides high-quality patient care as the highest priority. Welcome to the show, Dr. Emily. How are you today?
I'm doing great, Mike. It's really good to see you again.
Yeah, it's great to see you as well. Let's start here. If you wouldn't mind sharing a little bit about your professional journey and what inspired you to pursue a career that blends both patient care and organizational leadership.
It's a great question. One I've certainly been asked and have asked myself, right, how I ended up in this role. There aren't a lot of dentists out there who have, found a way to blend clinical care and operational skills. I feel really lucky to be in this position. It's not a role I ever sought out for myself directly. It really happened naturally and organically. It's been a fun journey. I started as a general dentist. I'm still a general dentist. I still practice every Monday. As I was, just beginning my career here in the Chicago area, I was interested in getting clinical experience, right? Building my skills, certainly earning a paycheck. Student loans are real for those younger clinicians out there. Student loans are real. And I needed to become, as busy and talented as I could be as quickly as possible. And so I was lucky to work with some really great dentists who were, wonderful colleagues, good mentors. I had a few different positions as an associate doctor around the Chicago area. I really learned that I love working with children. This is not something that I knew in dental school, but through practice, I realized that was really my passion. So eventually I joined up with United Dental Partners. Our mission is really to help patients of all, ages, but we do focus on children, and we do accept all insurance types, including Medicaid for children. So that is a passion of mine, is to work with underserved populations. I found a great job doing it with them as a full-time dentist. And over the years, I took on a larger and larger leadership role within the group through our compliance program, eventually in clinical leadership, and finally as chief operating officer as well. So it's been a journey where really I just kept saying yes to things as opportunities arose. And I think that would be one of those tips I would give people, is if you're looking for something in your career, right, keep saying yes to things until you really find the right fit. Easy to learn that way.
Yeah, it's funny. A lot of people talk about how you have to be so protective of your time. And I listen to a lot of different podcasts, and the message is always like, well, make sure you're saying no to lots of things. But I think that you have to say yes to many, many things until you get to a certain point, and then you have maybe some more of that freedom to be saying no. So I think it's really, really smart. It allows you those opportunities to try new things that might not otherwise have presented themselves to you. You mentioned having a passion for children and children's dentistry, and that's a big focus for United Dental Partners. What do you think are some of the key components to really being successful in practicing dentistry with children?
With kids, personality and how they feel is everything. And this is true, though, with adult patients. And so, again, when I talk with the doctors within United Dental Partners, there's about 70 dentists. We have, pediatric dentists, general dentists, and oral surgeons, plus orthodontists. And really, no matter which doctor I'm working with, a lot of the key themes come through no matter what their specialty is, which is we need to make sure the patient feels very well cared for, that they feel comfortable, that they have a good experience. And that is particularly true with children, because children will tell you on the spot that they're not happy. And they'll tell you either through their words or by crying, kicking, screaming. Right. Adult patients, though, they may be having those same thoughts and feelings. They're not going to tell you, though, until they either just decide never to come back, they leave you a horrible review, right? All the things that grownups do to manage their own stress and fears, kids are going to tell you on the spot. And so the great thing about pediatric dentistry is you get almost instant feedback on everything you're doing. And it lets you learn really quickly. And for me, I think it's a lot of fun. And so if you can try to incorporate fun into your job every day, whether you're a dentist, a dental assistant, front desk team member, even at the home office, right? If you're part of the finance team, if you can try to have fun every day at work, it makes any job better. And that's especially true with pediatric dentistry. So I think that's what's cool is like fun is encouraged. Not always the case in other roles.
Yeah. When you're hiring for new clinicians, and is there anything that you are expressly looking for, or anything that any techniques or approaches that you take in the interview process to ensure that they're going to be a good fit with your team and that they're going to be great as pediatric dentists?
Yeah. So whether I'm interviewing a general dentist or a pediatric specialist, if this new doctor is going to be working a lot with younger patients, our patient demographic is definitely skews on the younger side. But we do have teenagers there too, and oftentimes they're parents. So younger families, I need doctors who are open-minded, who are willing to try new things. Many of us did not receive a lot of pediatric training in dental school, and so I need doctors who are willing to step out of their comfort zone, open to mentorship, training, and coaching. We have a great clinical team within the organization. We can get the doctor whatever they need to be successful. I need people, again, who are willing to step up and say, yes, I'm willing to try that, or yes, I'm willing to learn something new. And the way I kind of ask questions to get at that is I talk about other work experience, right? What type of history do they have in exploring different areas outside of dentistry? And then how have they dealt with a challenging coworker or patient situation? And you'll learn a lot from people when you hear about times that they felt upset or frustrated, right? Or where someone really made them feel bad or uncomfortable at work. Depending on what they share about those situations and how they resolved it, tells me a lot about how they're going to interact with patients and their team, and with the organization as a whole. None of us are perfect. So finding those people who are willing to learn and grow with us rather than, be an antagonist. Like, I'm looking for partners and to come on the journey with me.
Yeah. When we were at dinner, you had mentioned when hiring new dentists straight out of dental school that one of the things that you look for is that there actually is real world work experience in the past. Can you talk about that a little bit more and kind of what that work experience can look like? What is important for you to see when you are hiring right out of dental school?
Yeah. Well, I'm glad that you brought this up. It is a passion area of mine. I love people who are passionate about work, and I want to find people who have had real meaningful experience in working with others. That could be in a dental office. It could be in any other industry, right? So some of the friendliest and quickest learners that I've hired, one of them had history as a restaurant server, right, as a waitress. Another person had worked at a car dealership, right, and was used to being there, at the customer's kind of beck and call to, make the deal happen and really serve that customer. As dentists, we have a little more autonomy than maybe you do as a car dealer, right? But you really do need to be there to help meet the patient's needs, listen to what they're looking for, and then take, the steps to move forward together. For people who have never had a job at all, it is hard for me to help them understand what it's like just to get along with your coworkers day in and day out. In a dental office, there's a lot of different people, a lot of personalities. Some of our offices have close to 50 employees, top to bottom, right? When we count doctors, hygienists, assistants, front desk team. And so we need doctors who are able to get along with a wide variety of people and know how to resolve conflict and work together toward a common goal. So there's a lot of ways you can have work experience. And for those doctors, I was not lucky enough to never work before I became a dentist. I had had a lot of different jobs. I know people have different paths in life, but for me and in our organization, I need people who've had some type of work before they come and join us.
Is that common that people come out of dental school and have just never had any type of job dealing with the public or working in retail or doing anything prior to their desire to become a dentist?
I can't say it's the norm, right? And this is all just anecdotal from interviewing candidates. There are, though, a significant number of people who've been really fortunate. They have family support. Their family felt it was most important for them to focus on their studies, which I agree. It is important to focus on your studies. And I certainly have some, friends whose parents really didn't want them to work. And that's okay, right? Like there's lots of different ways to go through school. But yes, some people were lucky enough to never have a paid job until they became a dentist. And that's, again, I don't know the exact percentage, but there's some very lucky people out there. And becoming a doctor and working for others, that would be, I think, a difficult transition. I know people make it. Obviously, they make it. But your first job is always kind of a rude shock. And you can have that experience with someone else.
Yeah, absolutely. No, I understand and appreciate that. I'm curious. So what jobs did you have prior to becoming a doctor and starting to practice?
Sure. So my very first job ever was a babysitter. I think a lot of teenage girls, that is a first job. I became a lifeguard. That was a favorite job of mine. Swim instructor, camp counselor. When I think back, I actually worked a lot with children, so it's not shocking to me that I ended up enjoying working with children as a dentist too. I worked as a paralegal at a law firm after college. I needed to establish residency here in Illinois to get in-state tuition. I saved myself a lot of money by being an Illinois resident before going to dental school. And that was a fascinating year, right? I learned something totally new, not related to dentistry at all, not directly anyway. And then during dental school, I actually worked at the local movie theater. I had, more time than money, and my bookcase here behind me is mostly philosophy books. My husband supported me as I went through dental school, and then I supported him as he got his PhD in philosophy. So we've got a history of kind of supporting one another as we pursued the next challenge. And I think for me as a leader and clinician, I have an easier time finding other people out there who have really had to find their own way and forge a path forward as they're looking to achieve whatever their goals and dreams might be.
Yeah. It definitely instills work ethic when you've had to go through those different experiences. I too worked at a movie theater at one point in my past. And now I am always leaving the theater with all of my trash because I have swept up so much movie theater trash over the years. So speaking of, prioritizing patient satisfaction and business growth, before you took on your current role, you served some other key positions at United Dental Partners. You were the Senior Vice President of Clinical Affairs and Director of Clinical Development. So how have those experiences shaped you and your approach to being able to prioritize both the growth of the business and also patient satisfaction?
Yeah, well, I think what was really cool about stepping into my role as, Chief Operating Officer is I have a lot of clinical experience for myself, right, doing dentistry myself. And then through my growth within the organization, most of it was working directly with doctors, building their skills, working to, resolve patient complaints or challenges, right? These are the things that come up and require some attention and coaching. And it was very obvious to me that when we're taking great care of our patients, right, the business side will follow. And so often when a doctor is struggling to really deliver that level of customer service, right, that, 10 out of 10 review that we would all love to get, oftentimes it's around what type of operational support they're receiving. And so before you can really take great care of patients, you have to make sure you're taking great care of your equipment, of your teams, right? And that really gets into building culture. And so, I always preach that when we put our patient first, right, good things will happen. That is the rule to follow. When in doubt, make sure that you're doing the thing that is going to help the patient. And we'll sort out the details after that, right? And so I definitely work to empower my doctors and teams to find ways to solve problems in real time. We can learn and grow from their experience, good or bad, after that, right? But the last thing I want people doing is freezing, not finding a way forward, because that's when the patient suffers and that's when the business suffers. And so again, there really is no way to tease them apart. You can have the best doctors in the world. If they don't have a team, you're not going to have a business. You could have a great office and awesome teams and no doctor, right? And same challenge. So it's finding a way to get all of those pieces to fit together. And I've been lucky to, kind of dabble in different areas within the organization and build those skills over time.
You've mentioned culture a couple times. What does culture mean to you, and how would you describe the culture at United Dental Partners?
So when I, first joined back in 2016, dentistry was a lot different. Pre-COVID, right? Dentistry was different. The dental industry was different. After COVID, right? United Dental Partners, same as, most other organizations, we had huge amounts of turnover, voluntary, involuntary, right? Just the world's upended, right? A lot of people changed. This was a real opportunity for Keith, our CEO, and me to start fresh, say, what type of culture do we want to have, right? When you have half new people in an organization, that is a great opportunity to really reflect on what you want to build going forward. It let us go through a new mission statement, core purpose, and core values. And we did this rather than the leadership team just dictating what it was going to be. We did this with a sampling of team members from across the organization, from every role, and we made sure that we got their input on what we needed to be doing going forward. And this got us to a point where we actually have, values that people believe in. Now, maybe not everyone believes in it, but then that's not the right fit. And so for me, right, building a culture starts with assessing what you want it to be and taking everyone's view into account. Doesn't mean everyone's right, but when everyone has a seat at the table, we're going to get closer to something that works for everyone. And from there, it was about holding accountability to actually displaying those behaviors day in and day out, which of course starts with me, right? It starts with Keith. It starts with our HR leadership. It starts with our CFO, right? If we are displaying those behaviors and, treating our teams the way we want our teams to treat one another, over time, that momentum will build. And the people who get it, they will stand out. The people who don't get it, they will really stand out. And it becomes easy to see what changes you need to make to continue to grow and flourish.
I like the approach of getting additional feedback throughout the organization and really getting the buy-in of folks on as to, what those values need to be. When you first came up with the values for the organization, after going through that process, did you feel that they were aspirational, or did you feel it was where you were at today? And did it feel like something that you needed to really put a lot of work in to achieve and make it an accurate representation of what the values of the organization were?
So I would describe the values as where we were at on our best days, right? With our best teams. So not truly aspirational in that no one was displaying those behaviors or values, right? But certainly we're trying to reach a little bit here. And the really at the bottom line, we had to change a lot of people. And I think I knew that going into this process was that some of our department leads or, other key spots, we just didn't have the right people in the right spot. Now, some of those people, we were able to move them into a different spot where they were an awesome fit, right? And their skills were perfect and they were able to flourish. Other people, we had to invite to leave and pursue a different opportunity. But really it just had to be day in, day out. These are the behaviors we expect at all times. And if that isn't a good fit for you, that's okay. There's something else out there that will be a better fit. And that's, I think that was one of the lessons I learned, is that you can want to keep people to a point of no return, right? Like you can hang on to someone for too long. And so, learning to trust my instincts, and when something doesn't feel right, finding paths forward to really make sure that's true, and then finding a way to move forward positively and professionally.
Would you mind sharing the values that you came up with?
Oh, sure. Yes. So it's passion, pride, urgency, responsibility, and collaboration. And what's interesting is initially we only had 4 core values. I think 4 is a common number. We ended up having to add collaboration because without collaboration, those other 4, they don't really get you anywhere, right? You can get somewhere alone, but we've really worked to build a culture of teamwork. We call it phone a friend, right? And please, I hope Network TV doesn't come after me for using that phrase. But right, we really do want people to feel comfortable raising their hand and saying, I need help, right? I need support. I'm confused, right? Whatever it might be. We've worked really hard to encourage that, because what I've found is when you have an attitude of, why don't you know that? Or that's common sense, right? When you take that attitude with people, they stop sharing, right? They just shut down. So not only do you not know what people need to do better, they stop sharing ideas that could take your business to the next level. And you never know who's going to have the next great idea for your organization. And so if you're fostering a culture of it's okay to raise your hand and share, you'll get way further than if you have a bunch of individuals trying to, go it alone. And that's the beauty of a DSO. Compared to, an individual private practice. You get a lot more brains to, chime in and work the magic.
Yeah, absolutely. So you have these values, and in practice, how do you keep them front and center and keep them as part of the conversation when you're in discussions with people or when you have meetings? Like what is the approach that you all take to kind of ensure that it becomes part of like the DNA of your organization and the kind of underlying foundation of your culture?
Yeah, well, that is a great question. And this evolved over time, right? Like anything, you try a bunch of things till you find something that works. One of the changes I made right away, though, when I became chief operating officer is I have an all hands meeting where all of our office managers, all of our department leaders, me, right, our CEO, our CFO, pretty much everybody who's in a leadership position across the organization is at this meeting. It's once a week. It is a mandatory meeting. Of course, things come up and people will, duck in or out. We start that meeting, though, every week with a roundtable of recognition where people will share stories of their colleagues, their peers, people in their office actually exemplifying those values. And so it is a great way to, again, to share some of the good things that are happening and to help people recognize ways that these values present themselves and keep it fresh in people's minds. Other part of this is a daily huddle, which I'm sure is not news to anyone else at a dental office, right? But our daily huddle at the office, it includes a very similar shout out section where people are recognized for the ways that they have, displayed the values in helping one another or patients. And so it's a way that we do it across the organization, really lead by example. And then it happens every day at the office level too. We also have something called the Flossom Achievement Award, which is a little cheesy, but again, it's a fun way to recognize your peers, nominate them for this award, and it gets printed up and mailed to their office, and it helps people feel engaged, recognized. It doesn't come with a lot of dollar signs, right? Which is always nice because it is more than money that keeps people at work. You want to feel valued and noticed for the hard work that you're doing.
No, absolutely. I love the recognition, the constant recognition, because when you recognize behaviors that you want to see more of, you end up seeing more of them. So I think that's really important. You talked about the morning huddle. I'd be curious, separate and apart from the part about recognition, how do you structure your morning huddles? And you're right, like it's a common practice that many dental offices do each day, but many also don't. It's actually somewhat surprising in a lot of the conversations I have. It's like, hey, are you guys doing a morning huddle? And it's like, well, we say that we are, but we're not very consistent with it, or the structure of it is not very consistent. We don't have it formatted well. We don't feel like we're in a routine. So from your perspective, what are the most important things to accomplish during the morning huddle?
So we have been to that movie too, right? Like the daily huddle sheet that I inherited is not the daily huddle sheet that we use now. And it took a lot of discussion to figure out what works, what doesn't work. Our current template, which I'm sure will continue to evolve, it's a, standard sheet of paper, two-sided. The first side is really about numbers and KPI. Things like what is your goal for the month? And our goals are set for all of our locations. It's based on patient visits, actual productivity, how well we do at self-pay collections, right? Collecting the patient copay. And then what is our net promoter score, right? How much do our patients like us or not like us? So it's really those four pieces that are key to success, day in and day out. And we want our offices to keep those four items in view. The back page is all about people. And so that's where you will talk about what are some things on the horizon for the office, right? Are we hiring someone? Are we growing? Do we have a party coming up, right? Whatever it might be. What are current challenges or opportunities? And this could be things like the light in Op4 doesn't work, right? Like you want teams commenting on these things, making sure it's documented and acted on quickly. It's also time to celebrate and recognize one another. So that's where we talk about, right, the shout outs and, the Blossom Achievement Award. And so we try to keep a balance of, look, these are the numbers, and we are a business. There's a lot of different numbers that go into knowing if we're successful as a business. And then let's not forget that it takes a whole team to achieve that. So that's where we are for now. And I'm sure it will evolve over time.
You mentioned earlier kind of some of the benefits of being a DSO, the ability to learn from others and have more, human resources within the organization and lots of great ideas. You also made a comment about when you're hiring or recruiting people, it's not always just about the money. There's other factors that play into whether or not somebody wants to join your organization. When you think about kind of your hiring process and candidates that you're talking to that may be considering either another DSO or maybe joining an independent practice as an associate or taking a different path, what would you say are kind of the standout attributes or reasons why somebody should consider joining United Dental Partners versus taking another path?
Sure. Well, I think first and foremost, we really do have a team that wants to be at work, at least 9 times out of 10, right? We all have a bad day. We have a team that wants to be at work, that wants to be there to care for patients and wants to do that as part of a team. And so for me, at least as a practicing dentist, like I'm going to spend an awful lot of time with the people at that office. And so I want to know, right, how does it feel? If the office has a good, positive energy to it, it makes it a whole lot easier to do great dentistry. It makes it a whole lot easier to get patients to say yes to treatment. It makes it a whole lot more fun to go to work. And so I think where UDP, right, United Dental Partners really stands out is we have sincerely spent a lot of time, blood, sweat, tears, right, in building a culture that does put patients first. And the rest follows from there. So, right, our compensation, we make sure that we're competitive. I don't think we pay the highest dollar out there. I know we don't pay the lowest. We have very comprehensive benefits. All of those things, they do matter. Our office visits and, when the candidates actually come to the practice and spend time and they get to meet the team, that is really where we have started to stand out. I will say, too, that having a doctor in a senior leadership position does set us apart as well. Not every DSO has a clinician in a leadership role. Many have dentists that are advisors, right, or, a different level of engagement. United Dental Partners, we're doctor founded, we're still doctor run, and that makes a big difference for candidates, too. I think the last thing I'll mention is we have really reduced our turnover rate within our teams. So we have prioritized paying competitive wages to retain people. And that has made a big difference in the last year because, again, I'm sure many of the audience members know it is so painful to train a brand new person, and productivity and satisfaction decline when you're training new people.
Yeah, it's a great point. I did want to ask, it's been one of the kind of hot button issues over the past, 4 years now, ever since COVID, about the hiring challenges and the difficult labor market that everybody's facing. So obviously approaching it with a desire to limit the amount of turnover that you have makes a huge amount of sense. Are you also feeling those hiring challenges? And are there any particular positions within the practice that are exceptionally difficult to fill at this point?
So I'm happy to say that it's gotten so much easier to hire than it used to be. I think our most challenging spots to fill, hygienists are still hard to hire. And then we have traveling specialty teams. So with our surgeons and orthodontists, easy enough to hire doctors at this point. It's hiring really talented team members who are willing to travel with them. That is still much harder than it used to be pre-COVID. It's gotten better, but again, this is some of the area where you just have to be realistic about, are you paying a competitive wage for what you're asking people to do? And are you really trying to hire top talent? And it's worth paying an extra couple dollars an hour to get the right person to support that specialist, especially. Can really have a huge difference in that office's performance.
Now, I've heard in conversations with other folks that there can be hygiene drama within dental practices. And that there can be some friction sometimes between different hygienists and maybe some issues with potentially the perception of stilling patients or stepping on toes or doing things better or worse than each other. I'd be curious from your perspective, how do you navigate creating an environment where you can limit that type of drama or behavior as much as possible?
Yeah, well, one, I'll just say I have the utmost respect for hygienists and the hygienist leaders within the dental field. Like, thank you for everything you do, because it is such an important part of a dental practice. And getting a team of hygienists who sometimes have worked together for a really long time, getting them to really function as a well-oiled machine and put patients first, it can be challenging. This happens with doctors too, just to be clear. Anytime we have a large group practice with a lot of clinicians in there can be some, stepping on toes, some tug of war. And what I've found is the best approach. It is slow going, but it really is about setting expectations, oftentimes repeatedly, about, the behaviors that we expect within the office, right? Really highlighting if someone steps out of line, making sure that you share it right away, work through it. Ask a lot of inquisitive questions, right? Trying to gather information rather than going and making accusations. There just is no magic wand, right? It takes time to work through those personal conflict issues. And, just getting people to sit down and talk through it together. So one thing that we will do in practice is we use family meeting rules, where we will actually have the team come together. And we use this with hygienists or doctors, dental assistants, whichever the group might be. And we actually talk about how we're going to work through a few items that day and what the ground rules are for that discussion. And it's things as simple as, using I statements to talk about how I feel rather than talking about what you do, Mike, right? Like, I'm here to talk about me, right? And share how I'm feeling. I'm not here to talk about you. And just setting those ground rules though, and then having a word that you use, right? If someone breaks the rule or is upsetting to others, you'll yell ouch. And by saying ouch, right, it gets people to step back, slow down, rephrase what they were, trying to share in a way that is, positive rather than attacking. And again, these are not, I can't say it's the best part of my job. It takes time. It can be painful at times. It's worth it though, right? Like, it's worth going through those exercises, because when you get to the end and the team is happy and working well together, I mean, that is a great feeling. So I would sit through all the family meetings I need to get to that end result.
Yeah, that's really good. You made the comment earlier about how many DSOs don't necessarily have clinical representation in a senior leadership role. And I think you were right on that. And so when you think of things like on moving forward and with the kind of direction strategy that you're taking with UDP, what are some of the things clinically that you're just really kind of excited about in the future? Either, starting to implement in your practice, or things that you're thinking about that you haven't quite gotten to yet? Anything that's kind of top of mind right now?
Yeah. So, I mean, technology wise, as a pediatric heavy practice, we don't get a lot of the really exciting gadgets that some of our general dentistry or specialty offices get. So I'll be talking a little bit more about kind of the, diagnosis and patient experience side of it. We have not gone all in yet on AI for radiographs. So specifically, I'm looking forward to finding a tool that will help support our clinicians, our patients, and their parents, right, in really understanding pediatric specific, caries in particular, but other pediatric issues that go on. I know that AI tools will make it easier to have those conversations with parents, have them understand better, what treatment we're recommending and why. I also know that it will help our clinicians really deliver a more calibrated set of treatment plans. I'll never say identical, right? But I really look forward to having some, just good guardrails, second set of eyes to make sure that we're as calibrated and consistent as we can be as an organization to make sure that we're giving our patients the best care. So for right now, we are partnered with an organization called Retrace, and they handle our RCM side, and we've had tremendous automation on that end. moving into, computer vision and that side of it is kind of our next step. So that's what I'm excited about. And we've started on the back end, which I'm sure you've had a lot of organizations talk about. They really need to get their RCM under control, right? And tightened up. That has been our focus. Once that is running really smoothly, then it will allow us to pivot toward more, patient-facing technologies.
Yeah. Yeah. We did talk at dinner about Curodont. And is that something that is currently being utilized, or is that something that you're interested in exploring more? I gave you my best layman's approach at trying to explain kind of from my perspective how I've understood it to work. But what are your thoughts on that?
So again, you did a great job at explaining what Curon does. And for anyone watching who hasn't heard of it yet, it is meant to actually remineralize, strengthen incipient caries lesions, smooth surface lesions, things that are not yet a hole, to help protect and restore that tooth without having to pick up a drill and place a filling. And so for, teenagers in particular, and I've heard so many people talk about this, that in their teenage years, they ended up with a mouthful of fillings that, looking back at their x-rays now as a dentist, right, they may say like, wow, I wish my dentist had gone about this differently so that I'm not in the position I'm in now. So we are piloting it at one of our offices. The main challenge that we face as an organization is if Medicaid is not covering it, that is a big hurdle to many of our patients. So some of our offices have more self-pay or PPO insured patients, and that's where we're piloting it. I expect that there will be more coverage going forward. Things like SDF originally were not well covered by insurances. It's now, covered fairly consistently. So I think that Curodont over time and, with more proof in the pudding, right? Like more insurances will want to cover it. We're just not there yet. But I think it's a really exciting development, and it's something that I look forward to, hearing more from our clinicians who are using it, especially our hygienists, and seeing how this can be a way to help patients and build our practices.
Yeah. Talking to you, it's very clear that you really believe in kind of a culture of continual education. And I'd just be curious from your perspective, where do you go to learn? As you want to stay top of your craft and as you want to be the best leader possible, kind of what is your approach and where do you seek out new information?
Sure. So I'm a very happy and proud ADA member. So I always count on the ADA. I'm part of, the local group here and attend at least some of the meetings. I'm part of, the broader organization with the ADA too, and look to help out where my support is needed. For really clinical items, I'm part of the Seattle Study Club branch here in Chicago, Windy City Seminars. And that's, it's not pediatric focused. It's multidisciplinary. Great way to stay in touch with other clinicians within the area and just to, stretch my own imagination around diagnosis and treatment planning for cases that I'm personally not treating. It's good though to stretch those muscles and think about, what types of referrals could be indicated for my patients or their families. So it's a fun way to socialize and, build my skills. And then as you can tell, right, like leadership is a big part of this. I actually really count on my HR leader, Mary Lou Servin. She is a fantastic resource. She is just so passionate about building teams and leadership that she has recommended so many great books to me. But the one I would really highlight is Crucial Conversations. We have a lot of our newer office leaders read it as well. And Crucial Conversations is just a great way for someone who's new to leadership to think through how they want to handle, crucial conversations. And we can all think of one that like you don't want to have it. That's how you know it's a crucial conversation. And so the book just goes through really practical ways to get yourself more comfortable and more confident. And it's I think great for leaders at all levels, not just brand new leaders.
Oh, that's fantastic. I have not heard of that book before. We do a book club at Planet DDS, and there's a number of members of the revenue team that are in it. And they're normally like leadership and growth books. So I will certainly check that out. And I believe wholeheartedly that one of the biggest differentiators between okay leaders and great leaders is their ability to have those challenging conversations and not avoid them and not just pretend that it doesn't exist. And so I like that. Thank you. I will take a look at it. Last question before we wrap. What are you most excited about moving forward, either with your business or any dentistry in general? It can be very broad, but anything that looking forward towards the back half of this year really makes you excited.
So I think broadly, as dentistry as a whole, I'm really excited for a few things that are on the horizon. One, the fact that Florida is making it easier for dentists to get a license is a huge step in the right direction toward license portability for dentists and hygienists. Like the fact that they are willing to open up that gate and talk about making it easier. I mean, that is just so exciting, I think, for the industry as a whole. I also want to call out the fact that ADA and ADSO have a much stronger partnership now than they have in the past. And so some of their recent collaborations, around lobbying efforts, the dental loss ratio, these are really big areas where more partnership is going to be good for everyone. And so it's exciting to see the way that different people within the industry are coming together at last to work as one to make it better for everyone. So I'm excited to see that. I'm also really excited to get more involved with Women in DSO. I'm a newer member, and it's an organization I think is fantastic. And so for me personally, that's what I'm looking forward to.
That was a fantastic answer. And thank you so much for joining, Dr. Emily. I really enjoyed the time. It was a pleasure chatting with you again, and appreciate it.
All right. Thank you, Mike. Have a great evening.
Yeah, you too. The Dental Economist Show is brought to you by Planet DDS. To find out more about how cloud-based dental software by Planet DDS helps unleash dentists and their staff to focus on patient care, visit www.planetdds.com. Stay tuned for upcoming episodes by following wherever you listen to podcasts. Thanks for listening.